Hello everyone. I welcome you all, the INI SS neurosurgery students who want to get into the INI SS program in the various institutes of national importance, to this brief discussion on how to approach the upcoming exam. See, the INI SS, it's basically more than 70% of the questions will be on the core subject, that is neurosurgery in our case, and around 30%, 25 to 30% of the questions will be based on general surgical aspects. Okay, so you are expected to know the basic concepts of neurosurgery for this exam. The exam has undergone its phase, year on year. There are various changes that are happening. Earlier the exam used to be a little bit more straightforward. The questions used to be very simple, very basic. Now the questions are more scenario based, very precisely you are expected to diagnose and to know the exact pathology what we are dealing with. So that is how the exam has evolved over the past 6 7 years. So doesn't mean that this exam is very tough, but if you can understand the basic concepts of neurosurgery, neurology, and neuroanatomy, then this exam is going to be very easy for you. First and foremost, there is no neurosurgery without neuroanatomy, neurophysiology, and neurology. All these together will constitute the most important aspects of neurosurgery. That is basic thing that you have to remember. Okay, so now coming to the preparation part. See, we have around a month's time. And so far, what we have analyzed over the past years and even the past question papers that we have solved, what we have seen is uh, the video lectures that we have undertaken in our DocTutorials platform. These videos have discussed the neurosurgery concepts and very important topics in a very concise and understandable way. And most of the questions have been made, or have, since we have taught the subject itself, the questions are from mostly from the videos. We have done a lot of reviews of the past question papers also, and even those we have seen that it's not like a straightforward pick from the textbook or from the notes, but rather it's like the concept that we discuss in the videos, that is what has been asked questions to you. So you have to understand a little bit about, and watch the videos repeatedly, and I believe you would have watched the videos and attended the tests that are accompanying the videos as well. So that will be the basis for your preparation. On top of that, when you watch a video, you make notes out of that video, and you use the notes to revise the subject, because that is how exactly you will remember things. Because once you read, we have a tendency to forget, and neurosurgery is no exception to that. So we have a tendency to forget what we have read. So that's human nature. So how to remember that is to take notes out of it and to revise it repeatedly. It is through repeated revision and repeatedly attending the MCQs, especially the grant test MCQs, and even the subject-wise tests. Even those, that is what has made people get very good ranks. Even people have went to the comprehensive board review, the USMLE series, all this, and they have found various sources of MCQs to solve, because that is what is going to help you to get a very good score. The difference between someone entering into rank 1 and rank 20, it's based on the number of times they have revised, and the number of MCQs and the grant test that they have solved. The thing about solving the grant test is that since if for example, if you have read about CNS infections, then it would be straightforward for you to go and answer the questions, because the memory would be very fresh. Whereas if you take a grant test, you would have read about neurotrauma or about neurovascular pathologies or even brain tumors some 3 4 months ago, and then now you are going to attend a test containing all the MCQ, all the topics. So in that case, and they are going to be mixed here and there. So in that case, the solving those questions will be a little bit more challenging, and on top of that, sitting in a place for 2 hours or 90 minutes and attending those MCQs, That in itself is a big challenge. So to in order for you to make that aspect easy or straightforward or simple, the best thing is to simulate the exam pattern in your room, in your study room. So how do you do that? And the same exam time, the roughly, it's best if you do it in the exact same time as that of your INI SS. If not, it's fine. So, for example, if your exam was at 10 o'clock in the morning till 12 o'clock, then for that 2 hours, you sit and write that grand test on any particular day. So you do that you continue to do that for the next 30-40 days. And then when you go to the exam, the feeling of the exam would be much easier for you. You are emotionally and you are psychologically tuned to sit and attend an exam. So that is the importance of the grand test. It's not like I am free at night. I have revised and I'm free at night, so I can write the test. No, that's not how it has to be done. It has to be done in a very systematic manner, where you simulate the exam feel while you are going to solve. And if you are not going to rule out even one option out of the question, then the probability of you getting a right answer is very, very, very less. So whenever you choose the option, even in the grand test, because the same mentality is going to be there for you in the INSS exam also. So in that case, the best thing for you to do is you rule out options. If it's a straightforward question, the question is going to ask you the total volume of CSF secreted per minute, then you will know the answer as 0.34 ml per minute. So that is a straightforward question. So you need not rule out options there, right? So on the other hand, if there is some question which is describing you some radiological features and asking you to pick out an answer which could be a differential diagnosis, you first rule out the options. And then you go on to choose the answer, because that is how you exclude the wrong answers, and the chance of you to pick a right answer is much more higher. So that would be one important thing that I would like to tell you. And slogging for long hours is not right. You take frequent breaks even during the preparation period. Like you study for an hour or 90 minutes, and then you take a small break, a 10-minute break, where you come back and revise what you have read and revised in the previous hour, and then start on the next hour. So at the end of the day, you will allot at least some amount of time to solve MCQs. And towards the far end of the day, for example, if you have a habit of sleeping at around 11 o'clock or 10 o'clock or 11 o'clock, and that previous hour, just the hour after the dinner, so let's say you have the dinner around 7 o'clock, and from 7:30 to 9, the 1.5 hours will be there only for you to solve MCQs and to revise what all notes you had taken the on that day. And similarly, when you begin the next day, the first few minutes or the first half an hour you would use for revising whatever you read the previous day. Because if you do it in that fashion, it would be like keep a repetition that is going to be registered in your mind a lot. So revise your notes, solve a lot of MCQs, attend the grand test. This has been the secret of success for people in the past. And if you want to take certain important topics, like for example, one very important topic is about cerebral edema. So I am going to do a screen share now. So I'll write some of the topics which are very important, and I would like you to revise them. Okay, I'm sharing the screen now. All right. So in this screen share, I'm going to write some of the important topics. One very important topic. These are general topics that I'm going to write. One is about the cerebral edema. One is about the cerebral edema. And the second thing, you have to understand the radiological features of most of the brain tumors, radiological features of brain tumors. So some MCQ will come out on this topic. Okay. And third thing, you have to know a little bit about epilepsy management. Epilepsy management, including the medications, and GBS on Parkinson's disease. GBS on Parkinson's disease. Then about on brain tumors, you have to know about gliomas and their gliomas and genetics. That is about the IDH1 or 2 mutation, about the ATRX mutation, about the 1p19q co-deletion. So all these are very important topics that you have to remember. Radiology of the brain tumors along with genetics, that is the genetics especially of the gliomas. These two chapters are of utmost importance. And one other very important topic that you have to remember is the intraoperative fluorescent guidance. Intraoperative fluorescent guidance for the glioma surgeries. For for the surgeries. This is another very important topic that you have to remember. Pituitary adenoma management. This has been asked time and time again. Pituitary adenoma management. This has been asked time and time again. Vestibular schwannoma. Vestibular schwannoma. One other very important topic is idiopathic intracranial hypertension. Idiopathic intracranial hypertension, and of course about NPH also. Functional neurology, especially about trigeminal neuralgia. Chiari malformation. Cystic lesions of the brain. A very favorite topic for the examiners is craniosynostosis. Shunt infections and management. Shunt infections and management. I'm not going into the details of vascular, because all the vascular topics are very important, especially the aneurysms, the AVMs. All these topics are very important, so I'm not going to go into the details. You are expected to know all of these in detail. And one very important topic is brachial plexus management. Then one other very important topic is going to be the carpal tunnel syndrome. The entrapment neuropathies, carpal tunnel syndrome. At least the foramen through which the nerves pass and how they get entrapped. At least that part is very important. And when you take a spine into picture, you have to know about atlantoaxial dislocation. You have to know about all the named fractures of the cervical spine. That is the Hangman's fracture, Jefferson's fracture, Orontoid fracture, so especially of the cervical spine fracture, and how you are going to manage them. All this you will have to know. And if you take the other very important topic is the tethered cord syndrome, the congenital malformation, tethered cord syndrome. That is a very important topic that has been asked time and time again. Evaluation and management of spinal trauma in total. Evaluation and management of spinal trauma, about all the spinal trauma, the role of corticosteroids, all the stuff. So that is again a very important topic. Then you have to know about trauma, about the EDH, SDH, ICH, evacuation, cranioplasty, CSF leak, CSF leak. So all this stuff you have to know very, very significantly. All right. So these are some of the frequently asked topics. 20 topics that I have given, but these are some of the topics that have been asked time and time again. So basically about cerebral edema, intracranial pressure, and how you manage it, the radiology of brain tumors, epilepsy treatment, including surgery, surgical aspect, as well as the medications, GPS, the DBS, the deep brain stimulation of on Parkinson's disease, tumors, especially the gliomas and their genetics, even medulloblastoma and the genetics is very important. Fluorescent guidance for surgery, pituitary adenoma, vestibular schwannoma, idiopathic intracranial hypertension, normal pressure hydrocephalus, trigeminal neuralgia, Chiari malformation, and other cystic lesions like the arachnoid cyst, craniosynostosis, shunt, VP shunt, that is the ventricular brittle shunt, infections and management, and also about the endoscopic third ventriculostomy, everything about aneurysms, including how you handle the intraoperative rupture and the grading, clipping aneurysm, coiling, all this stuff you have to know. And brachial plexus, especially the injury management, is very important. We have wonderful videos on that. Carpal tunnel syndrome, Atlanta axial dislocation, and all the named fractures of the cervical spine. I told you the C2 spine fractures and the C2, C3 subluxation, that is the hangman's fracture, chance fracture, all this you have to know. Tethered cord syndrome, spinal trauma, and trauma in general, especially about cranioplasty and CSF leak. So these are some of the very important topics that you have to understand. So now that the important topics I have told, for you, this is only for the purpose of revision and repeatedly correcting your mistakes. But all other topics are not. That doesn't mean that they are not important. These topics have been asked repeatedly. That is what I have given here, and I request you to go back and revise the videos on the past questions that we have made in our application, so that would help you a lot. And it's not like the questions are going to be repeated, but it will help you understand the concepts better. And frequently the topics there could be frequently repeated topics, but the most important thing is not the same questions are going to be repeated, but the concepts are certainly going to be the same. And one way or the other, most of the topics would have been discussed in the videos in one form or the other. So if you have the habit of reading Greenberg, then I would request you to watch the videos first, make notes of it, and then go back to Greenberg and add points if you want. Okay. And the most important thing is a repeated revision of the topics and solving a lot of MCQs that is going to get you a very good rank. So on this note, I'm ending the session today. So I request you to revise, because that is going to get you the top ranks. So all the best to every one of you who is appearing for the INI SS neurosurgery. And if you have any doubts, you can ping to me anytime. All the very best.